This is Dakota News Now.
And we've got 5 o'clock here on KSFY. Good afternoon, everyone. I'm Brian Allen.
And I'm Kelsey Passel. Thanks for joining us. 223. That is the current death toll in South Dakota as a result of the COVID-19 pandemic.
The South Dakota Department of Health today reporting 5 more deaths in connection with the virus. 2 of the victims we know were in their 70s and 3 were over the age of 80. Health officials also reporting 259 new cases today, while the number of active infections dropped below 3,700.
Meanwhile, current hospitalizations increased slightly to 211. According to the Department of Health dashboard, nearly half of the state's hospital beds and a third of ICU beds are currently available. Now, the number of hospitalizations continues to be the key metric, according to local government and health officials. And as that number continues to increase, so do concerns about capacity.
Yeah, we want to tell you this is a question we get every day from our group. Miranda Page spoke with doctors at Avera and Sanford about their hospital bed capacities and how they prepare for a possible surge in the number of patients. It is our 5 o'clock top story.
Over the past several weeks, Sanford and Avera have seen an increased need for care. However, doctors say not all of that is due to COVID-19. They believe some of it is because of delayed care. During this pandemic, some people have been too nervous to go to the doctor.
6 months ago, we would see somebody show up at the first signs of any chest pain. Now they're showing up with full-fledged heart attacks because they waited a day or two. And so then that causes them to stay longer and require more intensive care because they waited that time.
Doctors also want people to know if they hear a patient is being transferred, it's not due to a lack of room.
As we have facilities throughout this region, we at times may prioritize where can the care best be delivered and try to be thoughtful of that.
Avera says COVID hospitalizations make up around 10% of patients across their hospitals. Sanford says it doesn't report COVID numbers for individual facilities, but gives those numbers to the state. When it comes to hospital bed capacity, representatives from both Avera and Sanford say they're confident in the procedures and policies that have been implemented.
Certain areas of the hospital that we really focus more for the COVID patients, and that includes things like the air exchanges and just having the proper equipment for the staff to care for the patients.
The protocols about things like dexamethasone and how much oxygen to give them and how much fluids to give them have all been established and shared. And so now we've got a lot more ability to care for patients at all 37 of our hospitals.
Avera also says it has ICUs and hospital wings they can open up if COVID cases increase throughout the fall. Meanwhile, doctors want people to know there's more to consider than just looking at reported bed capacity numbers, as that can change hour to hour. Dr. Bassel recommends looking at the trends instead.
On any given day at 10 a.m., if you ask me that, I say, well, we don't have any beds available. But by 1 p.m., we try to discharge as many people as we can in the mornings, once they get up and the doctor's had a chance to see them. So that will be a totally different answer than in the afternoon.
In Sioux Falls, Miranda Page, Dakota News Now.
Kelsey, a little bit of a cool breeze blowing through our neck of the woods today.
That's right, but it feels great out there.
Yeah, the wind is pretty strong, and if you want to feel cool, though, that's going to be tomorrow. I mean, that's going to be a big change tomorrow from what we've had today. I mean, temperatures today in the 70s and low 80s. Tomorrow, and we're talking mainly 60s, maybe some spots only in the 50s. But here's a look at our wind that's coming in right now, and these are sustained winds at the top of the hour at or above 20 miles an hour over many locations, and it's gusting higher than that. 30 miles an hour or greater in a few spots. And so now tomorrow the wind is actually going to be stronger, believe it or not. We can have wind gusts 40 to 50 miles an hour in some areas. Right now, though, we have a nice warm up from yesterday, 70s and 80s. But tomorrow, as I mentioned, we're going to be a lot cooler than this. And we're going to keep that cooler around for a few days. But there is warmer air in our 10-day forecast and beyond. Details coming up just a bit later on.
All right, thanks, Phil.
Okay.
South Dakota remains among the states with the highest rates of new COVID cases per 100,000 people. Mayor Paul Tenhagen addressed the trend this morning on CNN. The mayor attributed the surge to a light touch approach from government regulation when it comes to mandates, and instead relying on residents to do the right thing in order to protect their personal freedoms.
I can see and appreciate that approach. It certainly made the phone ring in South Dakota from businesses and residents that are interested in coming to a state that is allowing people those personal freedoms. So we're balancing this economy, public health thing with, with surgical precision. It's very hard. but I continue to appreciate the approach the governor has taken.
Tenhaken says South Dakota is not hiding from the fact that cases are surging, but said healthcare systems in the state continue to say they're confident with being able to handle hospitalizations.
Around the region at this 5 o'clock hour, the Minnesota Vikings have suspended in-person activities after several players and staff on the Tennessee Titans tested positive for COVID-19. The teams played each other this past Sunday in Minneapolis. So far, the Vikings have not received any COVID-positive test results. At this time, the NFL plans on allowing both teams to play their games this coming weekend.